Doctors. Doctors have chosen a profession for themselves, which, on the one hand, potentially can take lives of humans if they are negligent and they do not attend to their duty properly. But on the other hand, they also have the potential of saving lives of humans if they are doing their job properly. The Quran is absolutely clear that the one who takes the life of an individual, a human, it is as huge a crime as if he has taken the life of the entire humanity. And if somebody saves a life, it is as immense a virtue as if the person has saved the life of the entire humanity. So, doctors have chosen for themselves a profession which is, from a moral point of view, very critical. If they do well, they can get themselves counted as the best of the humans. And if they do poorly, well, they can be categorized as the worst humans. So, from a moral point of view, this job, this profession is a challenge. And therefore, whoever goes into it should be careful about what he or she is doing in the profession. Doctors should not exploit lack of knowledge of patients. The people who come to doctors invariably are people who are ignorant about what disease they are going through. They are in trouble, they are in pain, but they don't know. And obviously, they, in most cases, rely upon the advice of the doctor. And the doctor is in a moral challenge. He, on the one hand, can suggest a cure which would take longer and would be more expensive. And on the other hand, he can mention something which is easier and cheaper to go through. So the best and the cheapest cure should be suggested by the doctor if he or she is a morally upright person. And obviously, this is what the challenge is. Moral challenge is always like that. On the one hand, we have worldly temptations which attract us towards doing something which is not quite as morally acceptable as if it was done properly, then one would have to forego those temptations. So, a good doctor would always give an advice which is not only correct, but is the easiest and the cheapest. Doctors also have another important challenge in the modern times. Quite often it is seen that there are doctors who are in connivance, are in contact with the pharmaceutical companies and with pathological labs, laboratories. They would suggest to the patients to go for a certain laboratory test and for certain medicines which could have been different, could have been lesser expensive, but they go for it at times because they have been tempted by the pharmaceutical companies and by the laboratories that if they are going to give the advice of visiting them by the doctors, they will get a certain commission, a certain amount as a part of the deal with the doctors. And obviously, when this is done, quite often it is not in the interests of the patients, because the patients are the people who will pay for everything that is delivered to them in the form of business. And quite often, this obviously is done, which is in a manner that is detriment to their welfare, in a manner that it doesn't help their cause. So if there is a person who is a good doctor, he or she will always go for a cure, a way of diagnosing which is the best for the patient, cheapest, quickest, and the most reliable. Obviously, if there are arrangements with pathological laboratories and with pharmaceutical companies wherein there is no damage to the patient, then one can say that the arrangement is not morally quite as wrong. However, if one is in contact with these companies and is only giving advice which suits those companies, then it can quite often be to the detriment of the patients. It is a part of the expectation of the doctors, from the doctors as professionals, that they would always go for the best interests of their patients. They would go an extra mile in attending to their needs. At times, they can be disturbed by their patients, where on occasions when they are with their families, they're doing things which want attention, but the patients need immediate attention of the doctors. And obviously, because they've chosen this profession for themselves, they are expected to make sacrifice of their time, of their immediate needs for the welfare of the health of their patients.